How many of you are familiar a couple of years ago with the story of the human trafficking, the Thai workers who were human trafficked, slavery? Well, we have two gentlemen here from the Thai community who will be speaking about the need for healthcare in the Thai community. Mr. Punnpavin Herabat and Andrew. Can you please welcome them up?
Thank you, David, and everyone for being here. Right, so good afternoon. Thank you, PANA, and all the other co-organizers for inviting us to speak at today's community forum. It's an honor to be here with you all to share about the experiences of the Thai community and express our support for Assembly Bill 1400. My name is Punnpavin Herabat, and I am the Policy and Planning Associate at the Thai Community Development Center, or Thai CDC. For 27 years, our organization has worked to address the multifaceted needs of Thai immigrants in the Los Angeles area. Many of these Thai immigrants are undocumented, low income, and lack access to quality employment, which poses a significant threat to their ability to access quality health care. For example, 69% of Thais have reported that they lack health insurance because they cannot afford insurance, do not work for employers providing a health insurance benefit, or do not qualify for medical or other public assistance programs, often due to their immigration status. Other factors, such as the language barriers, cultural difference, and the high costs of medications further inhibit Thais from accessing timely and effective care when needed. Consequently, nearly 50% of Thais have reported fair or poor physical health, and 63% of Thais have reported suffering from at least one chronic disease. The COVID-19 pandemic and resulting economic crisis have only amplified these health concerns and laid bare the glaring gaps in health coverage for immigrant communities under our current multi-payer healthcare system. To illustrate the human toll of our current healthcare system on the Thai community and other Asian and ethnic communities, I'd like to share a story about one of Thai CDC's clients who wishes to remain anonymous, but his story holds value and is representative of what many undocumented Thai and ethnic immigrants face in terms of having access to quality healthcare. He's an undocumented immigrant who's lived in California for more than 5 years. He works as a driver for a certain company and is living alone here in the United States. He did not have healthcare until 2 to 3 years later when he became Thai CDC's client through a human trafficking case. Our legal team at Thai CDC were the ones who enrolled him in a health program at Kaiser Permanente, where he pays per month $48 for healthcare and $12 for dental care. In terms of access to quality healthcare, he did not have such a great experience. One time he had to talk to 3 or 4 nurses, and had to wait 3 hours before he could get to see the doctor. Another time was when he took his ex-wife, to the hospital. His ex-wife, who was also an undocumented immigrant and had pyelonephritis, which is a type of kidney inflammation due to an infection, had to wait in a wheelchair in pain from 2 in the afternoon to 8 in the evening. Although she was put in the emergency room, she was not given any care. So essentially, she was in pain for 6 straight hours. Luckily, they eventually met a Thai nurse who was able to help rush the whole process so she could be treated. And given that he's limited English proficient, he would always have to use either Google Translate or call a hotline to be able to communicate with the healthcare providers, which has proven many times to be quite a difficult and burdensome task. More importantly though, this whole experience made him feel undervalued and less important as a person. Usually to receive healthcare, he would have to travel from another county to LA County just to receive care from a Thai-speaking doctor or a clinic that provides bilingual and bicultural services like the ones around Thai Town, which is far and takes up his time, money, and not to mention endangers him as he drives over here if he's sick. Another critical issue worth pointing out is the exploitation that undocumented immigrants face when they become dependent on certain healthcare providers that offer language services. They may prescribe medication at extortionate prices or ones that aren't necessary for the patient, which may lead to side effects or other illnesses that the patient may not be aware of, or they may simply not be in a position to speak of. For these reasons, undocumented immigrants undoubtedly face significant challenges and risks when it comes to having access to healthcare, access to quality healthcare. Thai immigrants like him are in need of transformative change in our state's broken healthcare system. Assembly Bill 1400 paves the way for a single-payer healthcare system that will ensure that all residents, regardless of income, employment, or immigration status, can get comprehensive healthcare coverage that is free at the point of service and more conveniently accessible. CalCare will also be able to negotiate bulk drug prices for all Californians and take other measures to lower the cost of prescription drugs. Furthermore, CalCare aims to increase the delivery of language assistance and culturally appropriate healthcare services that more effectively meet the needs of Thais and other ethnic communities. Together, these changes in our healthcare system would bolster accessibility and quality of care for Thais and other immigrant communities of color throughout our state. Now more than ever, CalCare is needed in order to guarantee the most vulnerable populations quality healthcare as a human right. We are proud and honored to work together with all of you to support AB 1400 and fight to advance healthcare justice for all Californians. So, thank you very much.
Thank you very much. Thank you very much, Mr. Herabat. Can we give Punnpavin Herabat another round of applause, please? You know, I heard that figure before, 69% not healthcare. It's kind of mind-boggling, don't you think? I mean, I can't wrap my head around it. 70% of people don't have healthcare. That's like, what do you think about that? You know, it's like, God.